Good morning, everybody, and welcome to our January 9:30 call. We're so glad you can join us, whether you're calling in from your office, classroom, your kitchen table, or sitting in your car in the drop-off line. January always feels like a fresh start, but we know that it's also a time when a lot is landing all at once. Today's call is a chance for you all to pause, connect, and make sense of what's happening across childcare in preschool in New Jersey and across the country all together in one space. We're also very excited to be adding a new legislative update segment to our calls this year. So you'll hear some timely information about policy and budget developments that directly impact your programs. And we'll share those updates, flag what's coming next, and let you know how you can get involved. And while we're really glad you're here, we're going to get started with our guest speaker, Jackson Richards. Jackson Richards, are you in the room?
Yes, I'm right here.
Oh, wonderful. I am really happy to introduce our guest speaker, Jackson Richards. He's the lead associate of the Education and Emergency Response Team at Save the Children. He's going to share more information about the Child Care Emergency Resilience Network and their hopes and plans to expand to include providers in our area here on the East Coast. Jackson, it's all yours.
Perfect. First off, I'd like to thank everyone for allowing us to speak today. I'm currently waiting on my other colleague, Militza Mezquita. She's actually the director of our Education Emergencies Programming, as well as the Texas State Director as well. So I will kind of just kick off with a more informal conversation of some of the work we're doing nationally and some of how we're hoping to connect with New Jersey and providers as well. I'm currently based on the West Coast, but I actually just came. I was living in Newark for the last 6 months or so. So I'm really excited to be here and talking to y'all today. So one of the things we kind of want to kick off by talking about is a little more about our organization. And I'm sorry, I do not know what's available. In these experiences, I've always found more just face-to-face conversation is the best. If anybody has any questions, comments, concerns, thoughts, please just ask them. I really don't want this to be one way. So just
I
feel
just wanted to say
drop
hi,
something.
Jack.
Sorry.
I'm sorry. I see Militza on
I'm
the
here,
call.
Jax.
Perfect. Oh, thank Lord. Hi, Militza.
Hi.
Militza, do you want to take it from here?
Sure. Yeah, absolutely. Hi, everyone.
I was just giving an overview of the organization before jumping into the work.
Wonderful. So my name is Militza Mezquita. I have the privilege of leading our Education Emergencies Department here at Save the Children, working alongside Jax. And in my short time doing this, I'm transitioning back to my old role as Texas State Director. And so we wanted to hop on here today just to talk a little bit about who Save the Children is, what we're trying to do in our ambitions to serve children in emergencies in the next few years. And really and truly, we've been doing this for 20 years since 2000, almost 21 years, since 2005's Hurricane Katrina. That was our first entryway into the intersection of early education and disaster recovery. And what we found is that we are one of two organizations who really helps the early education infrastructure get back on their feet through funding, through grant funding for childcare providers, grant funding to childcare resource and referral agencies, early ed organizations. Most childcare providers, probably about 90% of them, are not eligible for federal funding after a disaster hits, so FEMA specific funding. And so that's where Save the Children comes in to stopgap and to help. That way the infrastructure is back up and going. We're not closing. We don't see isolation and those things that happen over time as disasters happen. So whether it's, winter storms or tornadoes, floods, our industry gets hit year after year with these natural disasters or man-made disasters. Just saw an article about that we got notified over the holiday break. Car went through a child care center. So some of these man-made disasters also are impacting our child care infrastructure. And so what we wanted to talk about is a few years back in the height of COVID, we thought, how can we bring everyone together and really
There are so many people. Look.
come together and really think about how to impact in a meaningful way. And so we developed our resilience network, and currently it is sitting in the Gulf Coast, so it covers the Gulf states. But we've been chartered with expanding this group and creating new groups on the West Coast and East Coast. And we're really excited about the development of our East Coast group. And what we want is for boots on the ground, people in the trenches every day who understand the landscape in the area to come to the table with Save the Children and advocate and understand how can we be better prepared for whether it's a man-made disaster or natural disaster, and get that information and resources out to providers so they know how to come back and build that resilience and recovery. Every day that child care center is closed is one more, dollar left on the table that they can't recover. And eventually most of our child care providers will close and not come back online, which leaves more child care seats, which we all know the downward spiral from that. Parents can't get back to work, and then our economy starts to lag from that. And so really, we just wanted to pop online and let everyone know that we are going to start building our East Coast network, and just wanted an opportunity to tell everyone about it. Jax will put information, emails, all that stuff in the chat. But really, we want folks such as yourselves who come onto these calls who understand the childcare infrastructure in your area, whether you are a provider or you sit in a resource and referral agency, to really shoulder with us to prepare for natural disasters. And that way recovery is quicker. We can get funding out. We do funding year round. So whether it's a small disaster or a big national, something that makes the news, Save the Children has put hundreds of millions of dollars back into the early ed industry to make sure that providers have what they need to get back up and going. We were at the Child Care Aware Conference a couple of months ago talking about this on the 20-year anniversary of Hurricane Katrina. And that was one of the things that we were ultimately noted for was our funding is tried and true. We've been doing it for 20 years, and we want to help our communities. We want every provider across the nation to know that there is some help out there when they may think that there is no help. So aside from the funding, we also have a suite of trainings. So we have emergency preparedness training, and then we have our psychosocial support training. So we have trainings on helping caregivers cope. So maybe it's our parents in our childcare facilities that need help. We have helping our kids cope. So maybe it's our teachers that need a little information on how to get back in the classroom, because we might think we're ready to go back in the classroom. And then when we get in there, some of our teachers they're not ready because they may be dealing with something of their own. Kids may be experiencing things. And so we have a suite of trainings that we can offer that providers can get credit for. And they're really, really advantageous to understanding how to get back into the classroom. When does recovery happen? When does resiliency in children happen? And what are those long-term effects that we might see that might be okay, right? So maybe a disaster hit our area. It's been a couple months and we're starting to see some regression in the classroom. That's normal. Is that normal? And those key points to look for so we can support our children and families. So yes, and we do. It is for family home providers. It is for brick and mortar centers, for licensed, unlicensed providers. Our scope is if you are taking care of children, we want you in our ecosystem. That's a great question. Absolutely. So our suite of trainings are also tailored for either large centers or family home centers. Absolutely. We tailor it custom to your area, your need. So emergency preparedness training that maybe someone in Texas receives, it's going to be a little bit different versus someone in New York. We want to make sure that we localize everything so that it makes sense for your area, your needs, and your providers, and what providers in that area are really experiencing in that time. Ooh, awesome. Yeah, our emergency preparedness training went through a little revamp. And so it is, yes. So sorry, I see a bunch of questions coming in. I just won't get to them. Yeah, so our emergency preparedness training, we we revamped a little bit, and so it's about an hour and 15 of sort of lecture, Q&A, interactive, and then we go into about a 30-minute to an hour, depending on size, simulation where we do act out some of these emergency preparedness scenarios. Some of them are man-made disasters, some of them are natural disasters. And we can do it virtually, we can do it in person. And we've seen a lot of good results. And it has a complimentary manual, and it has all the tips and tricks and guides in there for social emotional support for children and caregivers. And it's really great. And then our trainings are really based for the providers. So our emergency preparedness training is really geared towards those serving children. And you can tailor it to maybe you need to look at emergency preparedness for your infant classroom versus your toddler classroom. So we look at it from different scope of that way. But our audience is generally for those that are serving the children. And then you can look at the emergency preparedness guide and really tailor it based on the children you serve. So it's really meant to be flexible and nimble in that way. Great question. Okay. I know I talked fast and talked a lot. Jax, did I cover it all?
You pretty much covered.
Wonderful, wonderful. We just wanted to hop on, give a little FaceTime, and just, let everyone know. I know sometimes providers and those serving don't know who Save the Children is. We've been around in the US for over 100 years. And we work really closely with the federal government and state government. So anytime there is a natural disaster, we're at the table advocating for early education recovery because it is important. K through 12, they have their infrastructure, their system, but there is really none for the early ed space. And so that's where we come in and sit at the table with the big decision makers to advocate on behalf of every provider impacted in that area. And so I will leave it at that. If anyone has any questions, Jax and I can answer.
I'm also going to drop a quick fact sheet in the chat that's kind of covers what Militza just said in terms of like some of the programming we're doing with training, resiliency networks. And ultimately, as we're looking to 2026 and beyond, I think it's going to get increasingly important that we create these smaller, tighter communities that are getting more prepared for events like Hurricane Sandy. The federal government is kind of withdrawing from a lot of these spaces. So I think it's really important now more than ever that we be prepared for, unfortunately, the worst, but we go from there.
Thank you, Jax and Militza. Does anybody have any questions?
There was just another question in the chat about family childcare, and yes, they are included in this.
Absolutely. Yeah, whatever training we have, if you have a specific niche, that's something that we're kind of known for, is we'll tailor it to that niche. So most of our trainings are sort of at a higher level. And then if you're like, I have this real specific niche that I really, really need to understand, our experts will custom tailor it for that specific need.
Militza, if one of our providers on the call here wants to get involved in the resiliency network, how should they reach out and what can they expect for next steps?
Great question. Go ahead, Jax.
I'll drop my email in the chat as well. It's also attached to the PDF that I just dropped in the chat. Reach out to me. We are hoping to deliver trainings either in person or virtually in the area. So if there's a group of providers that are interested in these trainings, we'd love to get something together. It's a relatively informal process, and we don't want it to be terribly formal, but essentially we would have a small, probably half an hour, 15-minute conversation about specific trainings we have and what your facilities needs are. And then we would just pick a training and pick a date. Save the Children covers all the costs, so we don't charge anyone to deliver these trainings. We have other money on the back burner for that. If there's enough people involved, we're happy to fly out and ultimately do these trainings in person, organize a space, maybe cater something for a half day. And ultimately, a lot of these trainings we deliver, we end up delivering on Saturday just because we found in the past our providers, that is when they are most available, but we are happy to do it pretty much anytime, any day. in whatever trainings, whether they're psychosocial trainings or accessing funding after disasters or emergency preparedness planning. And I'll drop my email once again and just reach out to me and we can get it to happen. It's truly as simple as that.
Great. Thanks, Jax. There's a question in the chat. Is there a program cost for the PD or are they offered free of charge?
And again, I cannot emphasize this enough. This is the first question we get, and it's the most important one. I completely understand. Yes. Everything we deliver is free. We will not charge a dime for our training, for our services, for our expertise. A lot of the providers we've been working with in the Gulf Coast since Katrina, we haven't charged at all. We're actually hosting a part of the thing we've rolled out as a part of this resiliency network is we're doing a summit right now. This year it's hosted in DC. So we're having and hosting some of the providers and partners that we have in the Gulf Coast area to come out to DC. And again, we're doing this free of charge to the providers because ultimately it is a barrier of access to all of these partners. And it's just super important work to consider. And really the biggest ask we have is just the time. But yeah.
Thanks so much. There you have it, friends. Free high quality PD for probably the one thing on your list that often gets pushed is developing that emergency plan. It's so important to have a preparedness plan for emergencies. And it is very easy to just get caught up in the day-to-day and not have the time to devote to that. So any bit of support, I'm sure, would be welcome. Before we move on, one last call for questions for Jax or Militza. Is there a list of trainings you've done in the past?
Yes. And there is a more comprehensive list I can provide if people are interested in trainings. There's just so many that we deliver. It's hard to go through all of them. The three main categories I would say are kind of one of the ones Militza highlighted in terms of psychosocial. So maybe that's developmental support after a disaster, preparing for that. And then there's what we call CCEPT, which is like emergency preparedness training or planning. And that's like developing an emergency preparedness plan. That is emergency contacts, things you should consider if like a hurricane hits or something of that nature. And then the last one would be like accessing FEMA or public funds. So that would be whether you're a nonprofit provider or a private provider. We kind of talk through the different routes of what funding is available. And I know that sounds like incredibly niche and frankly not the most interesting training in the world, but we have found it's incredibly important for providers of all people to understand the funding routes after a disaster, because once a disaster hits, and again, whether it's a man-made like a single building fire or whether it's a large scale hurricane, a lot of providers do not have the information readily available, partially because it is not often readily available to recover quickly. And a lot of these funds are first come, first served. So those that understand where to access these funds and how to apply to them often are the first ones to come and get served. So I'm seeing one more question. Do you assist with continuity of care planning? That is an element that I believe is addressed in our the child care emergency planning or preparedness training. Thank you, Militza, for dropping my email in the chat. I was just about to do that. Yeah. That is, but continuity of care planning is kind of an element that we talk about. And part of our training as well, as Militza indicated, we really try to highly tailor it to the facilities. So depending on what their objectives are with the training, if continuity of care is a top priority, that will be a top priority in the discussion. A lot of them are a lot more concerned about funding. Some providers are a lot more concerned about physical infrastructure and resilience. Some of them are more staff planning. And there's a lot to cover, and we can certainly make it a presentation that is a lot more to cover, but it just depends on people's time restrictions, limitations, and the information they're most interested in.
Great. That was great. Thanks, Jax. There was another question in the chat. To access the trainings, you could reach out to Jax directly. He did put his email in the chat, and I will also be sharing that as well as the resources he shared on this call in our follow-up email. And if nobody has any questions, or Jax, Militza, you have nothing else to add, we totally appreciate the time you gave us today. And we're looking forward to continuing to engage.
Absolutely. Thank you for having us, and reach out to Jax, get that resource. We'll come out to you. We'll make it happen. Don't be too shy. We look forward to seeing everyone, and thank you everyone for your time, and Happy New Year.
Happy Monday and
Happy New Year. Thank you.